Hello, I am Urologist Ömür Erdem Akkaya. Today I'm going to give you a short video presentation on how we can reduce the risk of forming kidney stones. 1 in 4 patients who come to our clinic report back to us within 2 years with the formation of kidney stones. What can we do to prevent kidney stones? First and foremost, water intake. What should I look for in water intake? When our daily urine increases from 800 cc to 1200 cc, the probability of stone formation decreases by 81%. This is one of the most important criteria. The other is the amount of calcium and magnesium we consume daily. If the daily amount of calcium we take stays below 1 gram, oxalate absorption increases, and the recommended target amount in the diet is 1 gram. When you take calcium, it combines with oxalate and causes it to be excreted from the intestines without being absorbed. Therefore, it is necessary to pay attention to the intake of calcium and magnesium in the diet. Another is the amount of salt we take daily. It is necessary to limit the amount of salt we consume daily to 2 to 3 grams. If the amount of salt increases, stone formation will also increase. Another criterion is the potassium we consume daily and the alkaline diet we follow. Potassium and alkaline diet increases the pH of our urine and decreases the acidity of urine. Decreased urine acidity also decreases the formation of calcium oxalate stones. The next thing is the amount of protein we eat every day. If we limit the amount of protein we consume daily, especially if we can reduce it to 1.5 grams per kilograms, we see a decrease in stone formation in patients, especially animal proteins. Another criterion is citrate intake. What is citrate? When citrate is combined with calcium, it is a substance that allows calcium to be dissolved and excreted in the urine, but when citrate decreases, the combination of oxalate and calcium increases. When we take citrate, the easiest way to take it is with lemon. The calcium will be excreted without crystallization in our urine. You can achieve this by including 1 or 2 lemons in your daily diet. The other criterion is oxalate, low oxalate diet. How do you do a low oxalate diet? Oxalate is found mainly in green leafy vegetables, it's found in hazelnuts, it's found in chocolate, it's found mainly in spinach. With a low oxalate diet, we can also reduce calcium oxalate stones. The other thing is vitamin B6. It has been found that the risk of stone formation in patients with vitamin B6 deficiency is reduced by 30% when vitamin B6 supplementation is given. Such a serious rate. The other criterion is probiotics. These have also started to become popular recently, in the last few years. Oxalate-degrading bacteria live in our intestines. Bacteria that break down oxalate can be increased with probiotics. When oxalate-degrading bacteria increase, oxalate absorption also decreases, so stone formation decreases. However, if you take antibiotics, oxalate absorption may increase because the oxalate-degrading bacteria die when you take antibiotics. There are ongoing studies on this. Another is phytic acid. Phytic acid is found mainly in whole grain products or legumes. A reduction in stone formation has been observed when phytic acid is consumed in the diet. Finally, sugary drinks, which are drinks containing sucrose or fructose, have been found to increase stone formation. If we just look at it, if you follow the 5 or 6 suggestions here, the probability of stone formation will decrease very significantly, but no matter what, consult a urologist before following these recommendations. Act on their recommendations. If you have any questions or comments, I'd be happy to answer them. Thank you.